Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of PID are all except. In PID, the temperature is more than 38 degrees Celsius, WBC is more than 15,000, tenderness is seen on movement of cervix, whereas ESR is 10 millimeters per hour is not true. According to the criteria, ESR should be more than 15 millimeters per hour. Then, during laparoscopy, the preferred site for obtaining cultures in the patient with acute PID is the preferred site for obtaining cultures in a patient with acute PID is fallopian tubes are the preferred sites for obtaining cultures. Then, asymptomatic carriage of gonadal infection in females is commonly seen in asymptomatic carriage of gonadal infection in females is commonly seen with endocervix. Then, gonococcal vaginitis occurs in infants. Gonococcal vaginitis occurs in infants
because infants have transitional epithelium and gonococci is resistant to squamous epithelium and adults have squamous epithelium in the vagina. So gonococcus cannot cause infection in the adults but it can cause infection in the children due to its transitional epithelium.
Then, which of the following cannot be detected by wet film? Chlamydia cannot be detected by wet film. Candida, Trichomonas and bacterial vaginosis can be detected by wet film but not chlamydia. Most sensitive method for detecting cervical chlamydia trachomatis infection is by culture on irradiated McCoy cells. No. That is specific method. But if you want sensitive method, most sensitive method is polymerase chain reaction, and it is nucleic acid amplification test can be done for detecting the chlamydia trachomatis infection.
thank you and thank you for watching.